Hello, my name is Dr. Fatima Cody Stanford. I am an obesity medicine, physician, scientist, educator, media professional, and policymaker here in Massachusetts at the Massachusetts General Hospital and at Harvard Medical School. So I want to tell you a little bit about who I am, how I got where I am, and hopefully inspire you as you decide to do your next step from where you are today to where I am. So I was born and raised in Atlanta, Georgia. I have a wonderful family that still lives there, my mom and dad, along with my sister, and really knew pretty early in life, around the age of 3, that I wanted to be a physician. At that time, I also wanted to be an actor and a lawyer, so I guess we got the physician part of the puzzle. And it was in that time that I really began to think about how can I make this dream a reality? And I began to study super duper hard. I spent a lot of time doing reading and things, but I was also doing things that were fun. So for example, I was a cheerleader, I was captain of the track team, but I also did a lot of studying and I did a lot of research. So when I got to middle school was when I did my first research project. And from there, I went on to do a big research project in high school that allowed me to go and represent the United States of America at the International Science and Engineering Fair. And so that was a great honor for me to be able to do that. In addition to this, I decided that I wanted to continue to do things in my life that helped me feel happy. So for example, I learned how to dance very early, and not just learned how to dance to popular songs. I'm trained in ballet, jazz, West African dance, point, and hip hop. And so those were things that I did. And I even minored in dance in college, which means that it wasn't my main thing, but it was my secondary thing. And that's something that I continue to do today to keep myself healthy and to keep myself engaged. In addition to this work, I did my master's degree in public health, which means that I cared for the health of the public. Many of you have heard of COVID-19, for example. That's something that affects the public. And so I became someone that was adept and really able to treat and think about how to look at large populations. I worked at the CDC before. I worked at the American Cancer Society. I also have worked at the Discovery Channel as a media person. And so I've had some great times doing a lot of different things. With regards to medical school, I went to medical school and I ended up doing or completing residencies, which means that I'm able to take care of different people that are both kids, so pediatric patients, and adults. And I thought that was really exciting, but I wanted to figure out a way to make a larger impact. And so I decided to study what's considered to be the biggest chronic disease, which is obesity. And if you guys don't know this, obesity is a disease that can progress over life, and it affects 42% of adults. So 42% of adults in the United States and about 20% of kids like you guys. So my goal is to figure out not only how to treat it, but how to make someone have their happiest, healthiest life possible if they struggle with this disease. And so I've been a leader in many organizations, really seeking to make this my life's work, to make it such that people that struggle with issues such as overweight and obesity have a better life. I also deal with issues surrounding racism and injustice, and I'm committed to this work to make sure that people that look like me get the same equal access to opportunities as other people. And I believe that we can do that if we are treating each other kindly, making sure that we acknowledge everyone's value and worth, and making sure that we support each other, regardless of how different we might look or sound or even think. And so I think that that's super important as you decide what you're going to do in your life, what you choose not to do, to respect others' choices, to be respectful, to honor and respect those that are near you. And even for those that may have strongly differing opinions, to continue to help them be their best self, like you're helping yourself to be your best self. So again, my name is Dr. Fatima Cody Stanford. I'm at Massachusetts General Hospital and at Harvard Medical School. It's been a delight to speak with you today, and I hope you gained something. Have a great day.